Hi, everybody. Like I said before, we will be covering Chapter 14, Exercise-Related Disorders, throughout these PowerPoint slides. Please read the chapter before continuing on. First of all, this should look pretty familiar to everyone at this point in the course. We know that physical activity offers many health benefits. But do we think that there's a point at which increased exercise might actually have negative health outcomes? And the answer is yes. And we refer to that as exercise dependence. So the definition of exercise dependence is just that craving for leisure time physical activity that results in uncontrollably excessive exercise behavior that can manifest itself in physiological or psychological symptoms, usually both. People with exercise dependence also continue to exercise despite injuries or illness. They experience withdrawal effects similar to that of alcohol or drugs. They give up social, occupational, and family obligations to exercise. So instead of going to family dinner on Friday night, they choose to go to the gym. They may not go to work one day because they want to work out. They might have a severe cold, but they're going to work out anyway. These are some of the dependence criteria that are used in order to actually diagnose this. So when we speak about tolerance, that means that we've become accustomed to, like the example given here, running 5 miles no longer results in an improved mood. Therefore, if I'm exercise dependent, I might have to run 7 miles to feel as good as 5 miles might make someone who does not have exercise dependence feel. I mentioned withdrawal earlier, and these symptoms are actually associated with the cessation of exercise or not exercising. So if someone with exercise dependence is not able to exercise, they may feel anxious, depressed, even fatigued when they're not able to exercise. Intention. So exercise is undertaken with greater intensity, frequency or duration, than was originally intended. So someone with exercise dependence may say, hey, I'm going to go out for a 5-mile run, but they actually stay out there for 7 miles instead. Those with exercise dependence also sometimes show lack of control. They spend a lot of time exercising. Like I mentioned earlier, reduction in other activities, and then continuance. So despite any sort of physical illness, injury, anything like that, they're going to keep exercising anyway. This quote really speaks to me in terms of exercise dependence, so go ahead and read through this when you get the time. We know that men are more at risk for exercise dependent symptoms than women. Why do we think this is? The answer is we don't really know, but some of the potential explanations may be that men could possibly be more perfectionists, have higher levels of obsessive compulsiveness or high trait anxiety, but this is not proven in the literature. What we do know is that these traits do have a positive relationship with exercise dependence, but we don't really know how that plays in terms of gender. We also know that self-esteem, neuroticism, and agreeableness have a negative relationship with exercise dependence, meaning the higher your self-esteem, the higher your neuroticism, the higher your agreeableness, the less likely you are to show exercise dependent symptoms. There's also some hypotheses out there that there's something maybe physiologically that we get addicted to endorphin dependence through exercise. But this is just a theory for now, nothing has been proven. We're going to go ahead and move from exercise dependence into eating disorders. And as you'll see, they somewhat play hand in hand. The difference here between primary exercise dependence and secondary exercise dependence is that in primary exercise dependence, the exercise is the problem. In secondary exercise dependence, the exercise problem usually comes after some sort of eating disorder. Anorexia nervosa is fairly popular. I'm sure we've all heard about that. It includes an intense and unrealistic fear of becoming fat and engaging in behaviors intended to produce distinct weight loss. So typically someone with anorexia nervosa will not eat this. They will literally starve themselves to lose weight. However, those with bulimia nervosa might actually have these powerful urges to overeat, which then leads them to binge, and that involves some sort of purging or compensatory behavior to avoid the fattening effects of that caloric intake that they binged on. So they might have a binge and then go to the gym and show those exercise dependence symptoms there. Some quick facts about exercise dependence. You won't be quizzed on these, but I just think it's really important to understand that at least 30 million people of all ages and genders suffer from an eating disorder in the US. That's about 1 in 10 people in the United States. That's very, very high. So this is a topic that we need to be sensitive to as we move forward as health professionals. Is exercise beneficial or harmful for those who suffer from eating disorders? What do you think? Take a minute, jot this down, and then we'll move forward. The literature states that the relationship between exercise and eating disorders is actually unclear. Exercise might play a role in the development of eating disorders, and this is when exercise dependence is present, meaning exercise dependence comes first, so that primary exercise dependence. The psychological health benefits of exercise might reduce eating disorder risk for individuals without exercise dependence. So those who do not have exercise dependence, exercise might actually help if they do have, it might help reduce the risk of getting an eating disorder. Have you ever heard of bodybuilding anorexia? You might not have, but you may have heard of muscle dysmorphia. These two are interchangeable. Muscle dysmorphia represents the pathological pursuit of muscularity, and it's characterized by this distressing preoccupation that a person is of insufficient muscularity, although most of the time they are very muscular. It's also characterized by excessive exercise and dietary practices that take precedence over any other important areas of life. Some correlates here. We know that social physique anxiety, depression, perfectionism, and mood tolerance have a positive relationship with muscle dysmorphia. And perceived body attractiveness and self-esteem actually have a negative relationship with muscle dysmorphia. That's why typically we see low self-esteem in those who suffer from this disorder. What health risks can steroids cause? A lot of people who suffer from muscle dysmorphia are involved in steroid use. Steroid use can cause hypertension, increased irritability, increased aggression, body image disturbance, mood disturbances. You're spending a lot of money on supplementation typically. All of these things have negative effects. I want you to go ahead, watch this BBC video about muscle dysmorphia, and once you finish this and have read through chapter 14, please take the quiz to follow.